how should we expect the rollout of psychedelic treatments? Like what should we expect it to look like? For example, will it be in clinics? Will it be in a hospital setting? In any scenario, would it be a take-home prescription medication? I'll leave that open to any
Well,
of you to answer.
I think that one of the things that we've touched upon is the medication and the psychotherapy, right? So I think both are there. I think for now, we are going to do our sort of hospital based just to be safe, just as we learn sort of in terms of how people can react, what a bad trip looks like, good trip looks like, and then sort of psychotherapy after that. I do see it heading into outpatients. I do see it happening that way, and Rob can speak a little bit to sort of, part of what we're going to, of course, try to figure out is, let's create let's modify the molecules so they don't have to last 5-6 hours. Let's find alternate ways of delivering it. Let's sort of see if we can modify things to have less side effects, have them more tolerable. Can we get the psychedelic? Can we get the benefits of it without the so-called experience that can be sometimes negative? But I think we're going to have institutions that are going to train people in doing these therapies, because the therapies are important. I think it's going to take a while for the universities to catch up and start putting it into the regular sort of PhD psychology and master social work programs. But I do see it rolling out, and I'd love to see a point eventually where we understand the molecules so well that somebody could take one a half an hour before their psychotherapy session in the waiting room, have their therapy session, and then be able to safely go home a half hour afterwards, maybe with the drive or maybe themselves. I think, but we're going to have to modify the biology of the molecule before that. And
yeah, I think to build on what Rakesh is saying, I think that really is the theme: is that we're seeing really strong data and results coming out around what I view as the natural product, or sort of the version 1 of the active in this therapy. And exactly like he's highlighted, there's really strong things that can be done in the formulation, in the exact delivery of the molecule and its co-formulation, to seriously address some of the known incompatibilities or known side effects. Certainly, the current group of actives that people have been looking at around psilocybin and LSD are very long acting, as well as there's a significant potential for anxiety. These are things that we're looking at as targets for our research, where there's definitely known ways that we can reduce the risk of those happening. And this is a major theme around regulatory approval of drugs, is understanding the side effect profile and then reducing it. And you see this highlighted in completely other areas of drug development, where the iterative improvements have been largely around safety profile, et cetera. And so I think that's something that will be addressing those issues in a pointed fashion, will both increase the access to patients across more indications, which is kind of a constant theme, but will also address a lot of the regulatory issues and regulatory concerns, which I think are going to be a major gating issue to this becoming more widely available. And so I think, to just sort of finally, address the pointed part of that question, I do think this will kind of go in a nested fashion of being an inpatient therapy to then an outpatient therapy, over a large fraction of the day. And then as the additional safety aspects and, understanding of the mechanism are understood, possibly outpatient. But there's a lot of questions that need to be answered before that's a safe choice at this point from a regulatory and medical treatment.